The Ukwanda Center for Rural Health derives its name from the isiXhosa word meaning to grow and to make a positive difference in the community. At the turn of the century, Stellenbosch University's Faculty of Medicine and Health Sciences had a vision to incorporate rural healthcare in its training, research and community interaction. This vision gave birth to the Ukwanda Center for Rural Health in 2002, and now, a decade later, the center has grown into the Ukwanda Rural Clinical School, where even more students can be trained in rural settings. But why the emphasis on rural healthcare? Worldwide, people in rural areas are generally in poorer health than those in urban areas. In South Africa, poverty and unemployment are common in these communities, and the shortage of rural healthcare professionals also adds to the health problems in these communities.
In South Africa, approximately 43% of the population live in rural areas, but only 12% of doctors work in rural areas. So there's a real need to train doctors and other healthcare professionals to equip them to work in rural areas. The problem with the rural health is that in rural areas, people have poorer access to healthcare.
In essence, many rural communities are disadvantaged economically and live under deprived socioeconomic conditions. Many of them may not be so, but they live in areas that are far removed from urban areas and from easy access to healthcare.
And generally, rural people's health is poorer than the health of people living in urban areas. But the healthcare workers, as I've said, is much fewer in rural areas.
And if their healthcare is only available in towns, or in particularly big towns, or in the Cape Town area, that means that if they don't have the resources to travel, effectively they don't have access to healthcare.
Stellenbosch University, the Faculty of Medical and Health Sciences, in 2002 established the Ukwanda Center for Rural Health. The purpose of the center was to create a platform for training medical students in rural areas. Initially, students were sent for 2 weeks to rural areas during their training, and gradually the exposure was increased and students could do electives and in their final year 5-week rural rotation. Then in 2011 we started with the Rural Clinical School, where selected students spend their whole final year in a rural area.
Our innovation in terms of the Rural Clinical School, however, is that students now spend a longer period of time under supervision of rural clinicians. And instead of having what we would call medical tourism going for 2 to 5 weeks or 6 weeks, the students now spend the whole year under the supervision of such clinicians.
International experience has shown that if you choose doctors from rural areas, they're more likely to go back to rural areas.
Students who train in rural and underserved areas and who are recruited from such areas are more likely to respond to job opportunities within those areas.
I think further that if they work in those areas, they begin to understand the problems of the communities, they have a better knowledge of the disease profile, and therefore in fact they're better equipped to provide health services to rural communities.
Ukwanda is an initiative of Stellenbosch University's HOPE project. The HOPE project seeks solutions to some of South Africa and Africa's most pressing problems through science.
Part of the HOPE project was taking science to society, and our faculty proposed that we would develop and establish a rural clinical school at Worcester Hospital, and using some of the district hospital in the various smaller towns that drain their medical patients to the Worcester Hospital, we developed our rural clinical school. So the philosophy was to say, take the students outside of the urban area, take them to a rural area. And because of the distance of having students away from, in a sense, our mother campus, the faculty had to develop innovative ways of actually communicating with the students. So it allowed us the opportunity to re-look at some of the e-learning opportunities and the telematic experience that our university has, and to actually apply it to a rural setting.
The Rural Clinical School's hub is in Worcester, and it has training sites in 13 other areas. The surrounding towns of Ceres, Robertson, Swellendam, Hermanus and Caledon have been identified as sites for the creation of the school's academic spokes, consisting of learning centres and accommodation. In 2011, 8 final year medical students were placed in 3 rural areas for the full year. All 8 graduated as medical doctors in December 2011. They were the first in the country to complete their full 6-year clinical training on a rural platform.
Dit het my geleer om meer independent te werk, meer verantwoordelikheid te neem, te leer om vir myself te dink en nie net gespoon-feed te word nie. As jy net 'n stryk werk, dan is dit die algemene goed wat jy sien. Jy sien ook die skaars goeders, want hulle moet van ergens afkom, maar jy sien ook die pasiënte soos hoe hulle oorspronklik sal presenteer. Soos jy is die een wat die diagnose moet maak. Die pasiënte is ongedifferentieerd. Hulle kom nie met 'n notaatjie wat sê hartaanval nie. Jy moet die hartaanval diagnoseer.
This year in Worcester has been really a great experience, really awesome. Working in the community has really humbled me in terms of the stuff we do at the rural school. It's really brought me close to the community, to the heartbeat of the community, and really revitalized me and given me new meaning to why I am studying medicine. So I'll definitely be working in rural communities from here onwards. Yes, it's been a good experience.